back in your mind. He's here. Dr. Yaw Osafo, CEO of Medical Hospital, East Legon Hills. Hello, doctor.
Hi, Kwame. Kwame, the weather is,
What has the weather done?
When the weather becomes like this, I start making orders in the hospital.
Orders?
Yeah.
What do you order for?
Birthing materials. 9 months down the line,
You would have work to do.
the maternity department will have work to do, and as CEO, I have to make sure that they're ready.
Really?
They have all the tools necessary.
Are you saying this is the baby making weather?
Kwame, those are your words.
So what?
And then you are playing the kind of music. Hey, Kwame. And you are kitty, the weather, then the music you are playing. And with me, I'm happy.
Why are you happy?
Oh, sir, the sales will be booming in 9 months' time. Maybe even Philip cry, he'll be my customer.
Your customer very soon. No. But really though, is it? Does the statistics support this argument?
Oh yes.
Really?
Oh, Kwame, no crepa. Oh, it's true. We see it 9 months from now, then you see. So you look at any maternity unit. You tell them, they will see where there's a spike in deliveries.
Well, guys, it is slippery. So be very careful.
Those who want, it's good for them. If you don't want to, then you send messages for Lexis to play different types of songs.
I know, right? Then I change the playlist for you.
You see, African Queen and all of hey, Kwame, that's your reaction.
I know. We used to do things with the song.
I tell you no lie. The lyrics now, choke or rehearsing or baby,
I remember it was yesterday. I think 2004.
Yeah.
I remember the year.
Yeah. Hey, Kwame. You use the lyrics for something.
No, let's save it for another day.
Right.
Anyway,
So,
welcome, dog.
Thank you, Kwame. It's good to be here another Wednesday.
Yes.
And
last week we did have a conversation about sickle cell. You
Yep.
gave a very, very good explanation of how it actually all comes about and the pairings and whatnot.
right.
So today we are going to activate the phone lines. If you're listening in, if you have questions about sickle cell in particular.
Right.
Yeah, I don't know whether we'll be able to take questions about other things, but today we just focus on sickle cell.
Yeah, Kwame. So today the focus is going to be on sickle cell. Because last week we didn't have opportunities to field questions either on our WhatsApp platform or directly phone calls. But I've had many calls, and anytime the subject comes up, there are a lot of questions that people raise from what is being a carrier, and how many of my children would have it, and its implications even on their quality of life. So before we open the phone lines, let me just remind us of what we discussed last week, and then also share a few other tips. So we did what we call genetic counseling. It is an inherited disease. So Kwame, you and I can't stop this disease in its track based on the decisions that we make about who would make the next baby with. All right, so you're going to bring another human being into this world, and it's part of being a quote-unquote responsible parent. You're going to make sure that that child doesn't live a life full of ill health, and that is what sickle cell. It makes life very, very, very challenging. If you have taken care of someone, you have lived with someone who has sickle cell, you would really understand what we are talking about. So sickle cell is an inherited condition, and we talked about the hemoglobin gene being the normal variant being A, and then you have the abnormal variant being S, and that you always need to have two copies, for it to express. The A is the dominant one. So anytime the A is present, even if you have an S, it doesn't express itself. And they would say the person is a carrier. So we looked at the different parents, and mentioned that depending on the permutation and combination, which you have no control over, the probability is just a roll of the dice. And I remember I mentioned the Konote, Aholu, Norm Ake dice, where the Kanat, as it is called. If you go online, you'd find it, and he's one of the greats when it comes to medical genetics, particularly when it comes to the hemoglobinopathies. So we looked at those possibilities and realized that it is not in your hands. We also mentioned that it can be detected. There are chemical or biochemical tests that we do, very simple ones to let you know, sickling positive, sickling negative, and then the specifics about whether you are AA or AS.
Okay.
So we looked at all of those things last week.
So phone lines are activated. You can call us on 0302-216-541 if you have any questions about sickle cell. Or send us a WhatsApp message on 055-1111-997. One of the things that I want to find out, we talk about the sickle cell crisis that people go through.
Right.
We talk about the quality of life and all. I'm trying to picture it.
Right.
And I'm sure a lot of people can't relate.
Right.
Do you understand what I mean?
Sure.
Except people who have seen it firsthand.
Yeah.
So, is it possible to give us an idea of what we are talking about?
Right. So, Kwame, let me paint a picture in the minds of all those who are listening. First and foremost, if somebody suffers from sickle cell, Kwame, when they walk into the consulting room, we know. All right? Just by looking at their physical features, you know, without the crisis.
Okay.
So let me share a few of them with you. So there's something we call frontal bossing. Mama.
Okay.
Mama, the frontal bone grows beyond what its normal limits are. As a compensatory mechanism, the bone marrow in there tries to make a lot more bone. So they've got this thing we call frontal bossing. They've got a very prominent forehead.
Okay.
All right. They're small for age. So I remember the first time I saw a sickle cell patient on the medical block in Kolebu as a medical student. I asked, the first question that came out of my mouth was, where's your mother? And then this man said, I am 38 years old. What do you mean, where's my mother?
Oh, wow.
And I had to apologize. That was my naivety as a medical student. But I'd forgotten that, they're small for age. So they don't reach their full growth potential. Okay. That is what we mean. Again, they've got these teeth arrangements that affects their frontal, their incisors.
Okay.
All right, their upper front teeth. It projects outwards. All right, we call it nathopathy.
Okay.
All right, it projects outwards. And you see the frontal bossing, small for age, nathopathy, then you almost know that this person probably or most likely has or suffers from sickle cell.
Okay.
Now, Kwabi, your blood vessels or your red blood cells carry oxygen throughout the body. So when they adopt that sickle shape, they block the lumen of the blood vessels and blood doesn't reach vital organs. So, for example, the bone is deprived of oxygen. And then you develop what we call a bone crisis, bone pain crisis. Kwame, it's just like, imagine having a fracture. You're a sports person. You play sports, so you know about injuries. Kwame, imagine having a fracture. That is the level of pain that they go through. And sometimes we have to quieten this down with morphine.
Wow.
All right? Or you just have to sedate them heavily to take that pain away. And imagine the number of bones you have in your body, and each one of them feels as if it's just been fractured. So the pain is just unimaginable,
right,
and it's everywhere. And if you're a parent, you watch your 6-year-old, 7-year-old, 8-year-old go through this, and the least you can do is to hold them. But I'm sorry, you cannot hold them.
Oh, you can't?
It hurts.
Dear.
Yes. It hurts like nothing you can imagine. So they don't want you to touch them. They're screaming their lungs out. They're in a lot of pain. They're crying. And you're a parent and you cannot even hold your own child to comfort them. So that's very terrible. Number two, the immune system also takes a hit. And therefore, they tend to get repeated infections. And again, because of this poor distribution and supply of oxygen to various organs. So no organ is in tip-top shape. So they tend to get recurrent infections and they make a lot of hospital visits. All right. They succumb to pneumonia, often. All right. So they're going to get a lot of hospital visits, hospitalizations, not just hospital visits, outpatient attendant, and you go, but then they are hospitalized, and Kwame, the financial burden. You've got other children at home, probably they are healthy, and then this one takes you into hospital, and the mother in particular, most of the time is the mother that has to stay in hospital, and then you leave the other children at home. So these are some of the this is the picture, of sickle cell.
Let's see who's here. Hello. Hello. Okay, I think our friend on the line can't hear me. But you can try and call back on 0302216541. I think we lost our friend. Is there on the line? Okay. No, right. I think we lost that.
But Kwame, then again, you also have something we call a splenic sequestration crisis, or a sequestration crisis, where blood sequesters in the spleen, and within a short period of time, the spleen is just so full of blood. It's not supposed to be palpable in the abdomen, but then all of a sudden it becomes so big, it's so full of blood, and it's like a lot of your blood has just gone in there and it's hiding in the spleen. That is a very, very, very dangerous situation that can actually kill the sickle cell patient.
Where's the spleen?
So the spleen is in the upper left side of the abdomen, where the liver is on the right, upper right. So it's under the rib cage.
Okay.
All right, on the right, and then the spleen is on the left. We don't get to talk about it often, but it's a very important organ that helps in the production of white cells, and then also our immune system, something we call the reticuloendothelial system, that sort of like helps to protect us.
All right, let's see who's here. Hello.
Hello, Lexis.
Yes, sir. Welcome. What's your name?
Collins.
All right, Collins, let's hear you.
Grandma Fuel.
Charlie, Mrs. Akwaba.
I will ask my question. But only time we primary school, me the like sickle cell there. No, my teacher school in Guame. So me papa be can't tell me boy. Me dey say, I'm busy at the papa. Catch him say me yes. You go be a young Guame.
Right. Yeah. Yes. Very delicate. Very delicate.
Papa say me boy no boy. That they go Guame. But my question is, doctor,
right.
But malaria, tutum come back up and malaria. The year almost say, me pacho, no, Mr. Wu, and then I also. Is there something I can do? Because telling malaria, and I'm not symptoms of malaria. And then if you come here, me say correct.
Right, you're correct. I mean, the normal variant of the hemoglobin that we talk about, that pigment that carries oxygen around your body, is A. But you remember that the hemoglobin has a specific function. Its job is not to protect you from infections, including malaria. Its job is to carry oxygen around the body.
Right.
All right. So the normal variant will carry oxygen around the body, but if you have a sickle variant like the S or the C, then its ability to carry oxygen around the body, which is a very good fuel for something we call aerobic metabolism, then that gets impaired. But it doesn't protect you from that. Actually, if you have one of the S and you have an A, we realize that those individuals tend to have protection against sickle cell.
Oh, okay. Right. That's interesting. Elikem says, Lexis, if you or someone you know has the sickle cell SC trait,
right,
what are the crucial conversations to have, the medical options to explore, and the support systems available to ensure a healthy future, especially when you're considering starting a family?
All right. So, Kwabe, if I got it right, the person is SC.
Yes.
That is their genotype, sickle cell genotype.
Right.
So they have an S and then they have a C.
Yeah.
All right. So if you want to start a family, then you've got a choice. That partner, they need to declare their assets as well.
Okay.
And from what we discussed last week, this person, anytime they split for reproduction, they will either produce an S, give an S,
Or a
or
C.
they will give a C. The two options, not good.
Okay.
In terms of their type of variant. They are both abnormal variants.
So let me guess.
So,
these definitely need to match up with an AA.
yes. Who called us earlier? You know,
Collins.
Collins, yes.
Yeah.
You need to find Collins.
Yeah.
You
Okay.
need to find Collins. You
I
need
see.
to get an AA because that person can also only produce an A during the reproductive, process.
Right.
So if the person produces an A and you produce an S, then your child will be an AS. That person would say it's a carrier or has a trait because the A would always overshadow the abnormal S.
Okay.
If you also give a C, that person would always give an A, and the child would be an AC.
Right.
And again, that person would be a carrier of an abnormal, hemoglobin gene. But the presence of the A would always overshadow that, trait.
Okay. Interesting one. Hello.
Good afternoon, Lexis.
Good afternoon,
And
sir.
doctor.
Welcome. What's your name?
Elvis Dustin.
All right, let's hear you, Elvis.
My question is, sickle cell, is there any cure at all? Please.
Right.
Okay, thank you.
Good question. Great question. And Lex, I wanted to show you something before we came on air, but I couldn't do that. I want to show you the cost of a new therapy that gives you what we call a functional cure. All right, gene therapy. And Kwame, it's about $2.2 million US.
Huh?
Yes. All right. So
2 million.
right. For gene therapy.
Wow.
So, of course, when you get it on a bigger scale in terms of the treatments, based on economies of scale, then the price is going to come down. But that is what I have seen from a friend who is working with a company that is producing, that.
Wow.
So, if you are looking at things like stem cell transplants or bone marrow transplants, then we can talk about a cure in that context.
Okay.
But now there's also gene therapy.
Okay.
For gene therapy, you're trying to do something with the gene that went wrong in producing the abnormal, hemoglobin variant.
Okay.
So there's a genetic disorder that has led to that. So yes, there is a cure, but it is not something that is available in any hospital that you walk into right now.
We can't buy the drug at the drugstore.
Debbie.
All right.
Debbie. You can't.
SC sends a message. Good afternoon, Lexus.
Hi.
Please ask daughter. I personally know someone who is SC, hold on,
Or
SS.
She's not
Says
sure.
she's not sure.
But this person has sickle cell disease.
Yes,
Be that
basically.
way.
She used to have very bad crisis, but in the past years, it has reduced considerably.
All right.
She says she goes to the hospital weekly for them to, in quote, clean her blood.
Okay.
She's based in the UK. What exactly is that process?
Right. So, not everybody with sickle cell SS now has a lot of crisis. A few things that have happened. There's a drug in town. It's been around for quite some time, but it was mainly used in treating some form of cancer. It's called hydroxyurea. And hydroxyurea is known to reduce the intensity of crisis in patients with SC and SS who otherwise in a year will have many hospitalizations or very bad episodes. So they're put on hydroxyurea, and all of a sudden, the number of times, and I've got a friend who lives in Birmingham in the UK, and the children don't visit or don't have as many hospitalizations as before because we were put on this particular drug. So that may be something that is happening.
Okay. Jesse in Sacramento says, Lexis, listening to the physical traits of the sickle cell disease patient brings memories of my brother who had the disease.
Wow.
I recall that several times he had to suffer and we couldn't do anything about it.
Right.
We unfortunately lost him at age 20. That's 28 years ago. He was an Odadie of the 1996 batch. Rest in peace, Agbeko Yaw Osafo, a.k.a. Mystic Adura.
Yeah. So that's my year group.
Oh, that's your year group.
Yes,
Yeah.
yes.
Oh, wow.
Yeah, Percent 96. Yeah.
So you probably might have come across him.
Yes.
At some point.
We had some mates who unfortunately have all moved, passed on,
Yeah.
since then. And one very good friend and mentor of mine in the field of medicine, Dr. Paul Mensah, also passed a couple of years ago. He was actually a hematologist.
Oh, wow.
As well, and he suffered from sickle cell.
All right, let's see who's here. Hello.
Yeah, hello, good evening.
Good evening, sir. What's your name?
I'm Kweku.
Kweku, let's hear you.
All right. Lexi, I didn't know I was a career until the age of 26. From my childhood, I could remember I was going through severe pain. Sometimes I could go to school healthy. Along the way, I'll fall sick. I'll be feeling pains. I'll be carried home. So 2009, I had an eye problem. I went to Kolebu. I was asked to do some series of tests. That was when I got to know I was a career. So I've advised myself, even when I'm going out with a lady, I don't want my children to go through that kind of pain. Lexis, I don't know if you felt that pain before. Even me, a career, the pain I was going through, it's a hell. And
Do you know your
sometimes I
sickle
do feel
cell
the pain.
group? Do you know your sickle cell status, your genotype?
Yes,
Are you AS or AC?
AC.
AC. Okay. All right. So then that's an unusual situation where they have so much pain. Sometimes the carriers, some of them may have a little bit of pain. It's not a typical experience that they have the same bone pain crisis as the SS or even the SC. Typically, the AC, AS, they wouldn't have. But I have, every now and then you come across people who are carriers who will tell you every now and then, especially when the weather is as it is right now, have a little bit of bone pain.
During this weather, it's so easy for me.
Really?
Yeah.
And I've been advised to take my folic acid daily. But sometimes after a dainty,
Oh.
then I'll forget.
Yeah. But I think you are making the right
experiencing the pain.
choices. I think you are making the right choices in being quite selective about who you would make a child with. You really have to know about that.
Certainly.
Yeah.
All right.
It's even more important than I love you.
Yes.
Yeah,
Yes. Absolutely.
That's right. Thank you so much, brother. Yeah?
All right.
Yeah. Whilst we are at it, Adam Elikem, who actually sent a message about the SC, says he's looking for an AA. So if you're an AA listening, please let us know.
Let
Because
us know.
at this point, it's like the sample size is very small.
The sample size very.
So all the ladies who are AA, please line up so that Elikem can make a choice because it's hard out there.
Yes.
In fact, Tete from Ashaiman Newtown just sent a message. Lexis, upon all the education the Drive Doctor is giving out for free and the people still don't take it serious, then I don't know their problem. Look, I work in a private clinic in Tema, and there's a sickle cell lady who has been on admission from Sunday till today as we speak.
Yep.
The pain the lady is going through, you have no idea.
Yep.
I want to plead with the youth to take this education serious and go to hospital or clinics to get it checked.
Just check.
And know their sickle cell status before they say, yes, I do to him or her.
Right. So thank you very much, Tete from Ashaman. So many people are actually very familiar with what we're discussing. But I think that taking the necessary steps to know your sickle cell status, it is absolutely crucial. So if you are 15 years plus, you are in that reproductive age group, 15 to 49, you are in that age group. Please walk into any hospital and just ask a very simple question. Can you determine my sickle cell status?
Okay.
All right. And if you have any doubt, just come to us. Let's do it and get to know.
Yana Kanesh is so funny. She says,
yeah.
I'm AA, but I'm already married. He like...
Oh, it depends on whether or not it's by ordinance or by...
Please. She's whether we don't want to know. She's off the market. You are AA, we here. Keep it. What is this? What
There's
kind
no
of
one sample size this one. And you want
but it looks like AA the crab. Oma yi bebre film. On my worry be brave. It is still. It's not even smaller than
not
before.
even smaller.
Yeah, now ube here. Okay, Lexis. My two brothers and I are all AA. Just in
Okay.
case any lady is searching. Our sister is also AA, but she's taking T for thanks. Alexander and Ablekuma. I think it has become a matchmaking.
It's become matchmaking.
Matchmaking.
So we on social media. App be on social media. Kwame Yente app.
Oh,
Nah,
sir.
yeah.
Some sickling love or something.
Aha,
So
bisa.
AA,
Yeah.
whatever, they will do the matching.
Matching. Yeah, idea
Yeah, But anyway, this has been some very good education. There are a few more questions that I wish we could answer, but time is far spent. So I would rather they call you directly.
Absolutely. Right. So for those who want much more education about sickle cell and want to actually do the testing, why don't you stop by Medical's Hospital or call us on 0501 477 340. Our WhatsApp number is also 0501 477 340. The test is inexpensive, and even if it costs a lot of money, I do not think it compares with the kind of challenges that new child would face. So please make the time, stop over at Medical's Hospital, East Legon Hills branch, or come to us in Mampong, or go to any hospital, healthcare facility, have a chat with a doctor and get tested.
Akosia sent me a message, and I would wrap up with Akosia's message. Lexis, my parents didn't know they were carriers until our last born started having crisis.
Wow.
We are 5 siblings, and 3 of us are heirs, and the youngest is the sickler.
Yeah.
He's 31 years now,
Wow.
and in his final year of medical school at UDS.
Wow.
His crisis was that bad, but thankfully, he's doing well.
Yes,
However, the vulnerabilities described by the doctor just reminded me of how granted we've taken his good health to be. I will check on him constantly. Thanks to the doctor for this reminder.
Wow. Wow. Nice summary. Wonderful.
Perfect way to end it. Dr. Osafo, thank you.
You're welcome. Kwame.
Amen.
Amen.
Yeah, app no today we have to do it.
Yes.
Sickle love
Sickle love.
connection.
Connection.
Just send us where your AS,
Yes.
then
SS.
we'll just find you. We will make sure no AS matches with another AS.
Debbie.
Yeah.
App never rejected.
AS no straight AA.
Sharp.
AC no AA. So say AA for no near here more
Yeah,
because
you're very
I'm
registered. The one bonus for registration.
Thank you, Doc.
When tomorrow